If you've been dealing with chronic pain that just won't go away, no matter what you try, I need you to hear this. The real culprit might not be what you think. It's not just age, it's not all in your head, and it might not even be the injury itself anymore. The hidden enemy could be chronic inflammation, and it's been sabotaging your healing this whole time. Today, we're diving deep into something that affects millions of people, but is seriously misunderstood: the connection between chronic pain and inflammation. And I'm going to show you why understanding this link might be the key to finally getting relief. First, let's talk about inflammation itself, because it's not always the villain. Inflammation is actually your body's natural defense mechanism. When you get injured or infected, your immune system sends white blood cells and chemicals to protect and heal the area. You've seen this in action. When you sprain your ankle, it swells up, gets warm, turns red. That's acute inflammation, and it's doing its job. But here's where things go wrong. Acute inflammation is short-term. It comes, does its job, and leaves. Chronic inflammation, that's when your immune system gets stuck in the on position. It's like a smoke alarm that won't stop beeping even though there's no fire. This chronic low-grade inflammation can persist for months or even years. And here's the kicker. While acute inflammation helps you heal, chronic inflammation actually prevents healing and causes damage to your tissues over time. Think of it like this. If acute inflammation is a helpful emergency response team, chronic inflammation is that same team accidentally demolishing your house while looking for a problem that isn't there anymore. So how exactly does inflammation cause pain? When tissues are inflamed, they release chemicals called inflammatory mediators. Things like cytokines, prostaglandins, and bradykinin. These chemicals do two major things. 1. They directly irritate nerve endings, making them hypersensitive. It's like turning up the volume on your pain receptors. 2. They cause changes in your nervous system that can make pain signals persist even after the original injury is healed. This is why people with chronic inflammation often experience persistent aching or throbbing pain. Joint stiffness, especially in the morning. Pain that moves around or affects multiple areas. Fatigue and brain fog alongside the pain. Pain that seems disproportionate to any visible injury. Here's what's really mind-blowing. Research shows that chronic inflammation can actually rewire your nervous system. Your brain starts interpreting normal sensations as pain. It's called central sensitization, and it means your pain is real. But the solution isn't just treating the injury site anymore. You need to address the inflammation itself. So, what causes this chronic inflammation in the first place? Let's break down the usual suspects. Diet. This is huge. The standard American diet, high in processed foods, refined sugars, trans fats, and refined carbohydrates, is basically rocket fuel for inflammation. These foods trigger inflammatory responses throughout your body. Stress. Chronic stress releases cortisol and other stress hormones that, over time, promote inflammation. If you're constantly stressed, your body is constantly inflamed. Lack of sleep. When you don't get quality sleep, your body can't regulate inflammation properly. Studies show even one night of poor sleep increases inflammatory markers. Sedentary lifestyle. Lack of movement allows inflammation to flourish. Exercise actually has powerful anti-inflammatory effects. Gut health. This one's getting more attention lately. An unhealthy gut microbiome, often caused by poor diet, antibiotics, or stress, can lead to system-wide inflammation. Environmental toxins. Exposure to pollutants, chemicals, and toxins can trigger chronic inflammatory responses. Autoimmune conditions. Conditions like rheumatoid arthritis, lupus, or inflammatory bowel disease create ongoing inflammation. The scary part: most people have multiple triggers happening at once. It's like pouring gasoline on a fire from 5 different directions. Okay, here's the good news. You have more control over inflammation than you might think. Let's talk about practical steps you can take starting today. Anti-inflammatory diet. Focus on fatty fish like salmon, mackerel, and sardines, packed with omega-3s, leafy greens, and cruciferous vegetables. Berries, especially blueberries and cherries. Nuts and seeds, particularly walnuts and flax seeds. Spices like turmeric and ginger green tea. Extra virgin olive oil. And reduce processed foods and refined carbs, sugary drinks and desserts, fried foods, excessive alcohol, red and processed meats. Movement. Regular moderate exercise is one of the most powerful anti-inflammatory tools. You don't need to run marathons. Even 30 minutes of walking daily can significantly reduce inflammatory markers. Yoga and stretching are particularly good because they combine movement with stress reduction. Stress management, find what works for you. Meditation, deep breathing exercises, time in nature, journaling, or therapy. Chronic stress management isn't optional if you're dealing with chronic inflammation. It's essential. Sleep hygiene. Prioritize 7 to 9 hours of quality sleep. Create a consistent sleep schedule. Make your bedroom dark and cool, and avoid screens before bed. Supplements to consider. Always consult with your healthcare provider first, but research supports. Omega-3 fish oil curcumin from turmeric, vitamin D, probiotics, magnesium. Work with professionals. Don't try to do this alone. A functional medicine doctor, nutritionist, or naturopath can help identify your specific triggers and create a personalized plan. Sometimes food sensitivity testing or comprehensive inflammatory marker testing can be game-changing. Look, if you've been suffering with chronic pain, I want you to know there is hope. Understanding the inflammation connection isn't just interesting science, it's potentially life-changing information. Your pain is real, and you deserve relief. But sometimes that relief requires looking deeper than just the symptoms. By addressing chronic inflammation at its root through diet, lifestyle, stress management, and professional support, many people find significant improvement in their pain levels. It won't happen overnight. This is about making sustainable changes and giving your body time to heal. But stick with it. If this video helped you understand your pain better, please give it a thumbs up and share it with someone who needs to hear this. Drop a comment below and let me know. Have you noticed a connection between your diet or stress and your pain levels? I read every comment. And if you want more evidence-based health content like this, hit that subscribe button and turn on notifications. Thanks so much for watching. And remember, you're not broken, you're just inflamed. And that's something you can work with. See you in the next video.